Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and today we are going to demonstrate the clinical methods in GIT, how to examine gastrointestinal system. Now I will demonstrate the method of shifting dullness. Now what is shifting dullness? If we examine, if we percuss, this is actually part of percussion. Now when we percuss the abdomen should give you a resonant tone, not very tympanic, because there is actually air mixed with solid structures, and intestines normally stay in the central part because intestine containing air, they actually are here, and when we percuss you should get a tympanic or resonant tone here, and when we percuss on the lateral side and as we move downward, in this part there is solid structure, our musculature. So all this area should be resonant. Now if there is ascites, this shifting dullness is specifically done when we suspect ascites. Of course, ascites would be visible on inspection also, but if you are asked to do shifting dullness, this is how you proceed. I will start percussion from here, come here, right, and then I will turn my finger like this. In this area there is no dullness because there is no fluid, but suppose there was dullness here. Suppose this was the area, the dullness starts from here. Maybe I'll go by 1 centimeter further down like this, and then ask the patient to take a turn. This part was resonant and this is dull. I'll ask the patient to take the right turn. Idhar ko ghum jaye. Like this, and like this. Wait for a few seconds, and if there is a fluid, it would displace. The fluid will go to the dependent part and intestine will come to this part. So this area, which was initially dull, will become resonant now. So I will percuss again. Now if this area becomes resonant now, that would mean that there is shifting dullness. Shifting dullness is positive, and positive shifting dullness would imply that there is a free fluid in the abdominal cavity. To make it further sure, if I don't percuss in the other direction, keep to the central part like this. I'm not sure if you can see this, but like this, if you go further and backward in the central part of the abdomen, this area which was initially resonant will now become dull. Then I'll ask the patient to take the turn, see the like this. And you could do the same method on the other side also. I don't see any point doing this on both sides. If you have doubt, maybe then you can do on both sides. If shifting dullness is positive, that would mean that there is free fluid in the abdomen. That means there is ascites. In some cases, of course we know in some cases, even fluid in the intestine, in people with paralytic ileus, intestinal obstruction, large amount of fluid in the intestine can also sometimes give rise to a positive shifting dullness, but typically it is seen in patient with this ascites. You know, ascites is very common. Once you have picked up presence of ascites, then you will be asked about the causes of ascites. You know, that would be based on the many things, and that is, I think, will be covered in separate video. Another test to do for the ascites is fluid thrill. Fluid thrill is much less sensitive than shifting dullness. If you have ascites, it is likely that shifting dullness is positive, but fluid thrill is not. And it is very unlikely or actually impossible to have fluid thrill positive and shifting dullness negative. Why? Because shifting dullness would be positive when you have any significant amount of fluid in the abdomen. But thrill will be positive only when you have large quantity of fluid sufficient to fill both paravertebral gutters and then sufficient to float over the spine. So when we tap from here, I'll put my hand here, and if I tap from here like this, and if I feel the thrill here, normally you should not feel the thrill, but if there is a fluid in the abdomen, when I tap here, the fluid there will be a wave, and that will be transmitted to the other side, and I will be able to feel that wave from here. Now, just to rule out that this wave doesn't get transmitted through the abdominal wall, we may ask the patient to put his hand here to block that wave. Idhar rakhiye zara, idhar. Yes. So, in this case, and I will put my hand here and tap with this side, like this. So, if I feel the pulsation despite patient putting his hand here, that would mean that pulsation, the pulse has actually transmitted through the fluid, and there is this fluid thrill is positive. And fluid thrill is positive only when there is very obvious large ascites. I could do from the other side also. I feel the pulsation here and maybe tap from here like this. Okay, thank you. So these are two signs of ascites: shifting dullness and fluid thrill. Shifting dullness is more sensitive, that means it is likely to be positive even when there is a relatively small amount of ascites, and fluid thrill will be positive only when there is large ascites. And then even if you do both the tests, a very small ascites can still be missed, and that I think can be determined with another clinical method, which I am not going to do because that is very awkward. Patient has to put on a knee elbow position and we percuss the abdomen from below. That might demonstrate the presence of fluid, but these days we do not do that because we have very useful tool, the ultrasound, which can pick up small amounts of ascites. So this was about the percussion of abdomen. Sometimes we do percussion of the abdomen when we suspect intestinal obstruction. Now, in intestinal obstruction, abdomen will be distended and you will have tympanic tone or hyperresonant tone, and you just percuss the abdomen like this. We percuss the whole abdomen. This sound is pretty normal and I don't see any distension, so no intestinal obstruction at all.